What's up, future nurse keys? It's me, Rap from rapsnursingnotes.com, and today's top 10 key points is all about fractures. So get excited and let's get started. Number 1. A fracture is a term used when there is a break in the continuity of a bone and can be caused by trauma, twisting, or bone decalcification, and other diseases. Number 2. Fractures can be described as a complete fracture, where the entire cross-section of the bone breaks, and then there's an incomplete fracture, where the break is only part of the bone, and then there is a closed fracture, when there is a break in the bone but there's no break in the skin, and then we have the open fracture, where the broken bone sticks out through the skin or some mucous membrane, and of course this is a higher risk for infection. Number 3. Some types of fractures are called green stick fractures, where one side of the bone is broken and the other side is bent, and then we have the transverse fracture, where the break is straight across the bone shaft, and then we have the oblique, where the break is at an angle across the bone, and then we have a spiral fracture, where the break twists around the bone, and then the comminuted fracture, where the break has more than 3 fragments. Number 4. Signs and symptoms of fractures, other than seeing a broken bone, are visible deformity of a limb, loss of functional ability, sharp pain, swelling and tenderness, redness, warmth, and numbness. Number 5. Your initial action as a future nurse in an event of a fracture is 1. Assess and manage their ABCs, airway, breathing, and circulation. 2. Immobilize the body part to prevent further injury. 3. And to manually apply ice, and if appropriate, elevate the affected extremity to help reduce pain and swelling. And 4. Assess their neurovascular status using the 6 P's: pallor, pain, pulse, paresthesia, paralysis, and polar, or meaning the temperature of the affected extremity. Number 6. If a fracture is compound or open, splint the extremity and cover up the wound with sterile dressing to reduce the risk for infection. Number 7. As a future nurse key, do not try to realign or rest the fracture at the stem because it may cause further injury and complications. Number 8. The goal of management for fractures are alignment and immobilization, such as 1. Using reduction, which realigns the bone to its proper place using surgical or non-surgical procedures. 2. Using fixation, which is stabilizing the fractured bone by supporting it with either internal or external structures. And 3. Using traction, which also helps decrease muscle spasm, uses a pulling force applied in 2 different directions. And 4. The use of cast. Number 9. In the post-operative care, if there is serious drainage around the pin site, this is normal and does not need any intervention. Number 10. Provide client education about the proper use of assistive devices. So for crutches, the 3-point gait can be used, which is when the patient moves both the crutches and the weaker leg at the same time. Then the client swings the stronger leg ahead to the crutches. For canes, place it on the stronger side. And for walkers, the client lifts up the walker and advances it and then steps forward. Alright, thank you so much for watching. So to get the most out of this, I encourage you to watch this video more than once. It's also good to rewatch this mini lesson as an intro or summary, or before or after a lecture or a reading session. And more importantly, go write out the top 10 key things for yourself. Go take a picture of it and send it to my email at rapsnursingnotes@gmail.com, and I'll post it on my Instagram at rapsnursingnotes. Hey, I just want to say thank you so much again for all you great future nurse keys who decided to learn with me. And so if you found this beneficial in any way, shape, or form, please share this video with your classmates. Like, comment, and hit that subscribe button, and trust me, you get an A on your next nursing exam.